If you have not yet undergone a hair transplant, and you're watching this because you're currently considering traveling to my clinic for your very first procedure, then please do not watch this video as it is completely useless to you. It's not for you. Now, if you're planning to go somewhere else first for a hair transplant, or if you've already had one and want me to fix it, then yes, watch this video, keep watching because you'll definitely need it. Why am I saying this? It's because if a patient comes to my clinic for their very first hair transplant, there is no way I'll ever need to use body hair follicles, either now or at any point in the future, because the manner in which I manage the donor area and the strategy I'll map out for both now and the future is such that we never run out of follicles until we have successfully met the patient's needs. But when patients come to see me, and literally dozens of them come every single week who have previously had surgery elsewhere, whether it was in Greece where they are told they are the surgeons to the stars, or perhaps surgeons with over 50 years of professional experience having supposedly done 100,000 surgeries, and they are ultimately convinced by such marketing tricks to trust them. These patients frequently end up arriving at my clinic with severely damaged and scarred scalps most of the time, where the follicles I can take from the donor area of the head are simply no longer sufficient for a full transplant, and I'm left with no choice but to look for hair in other areas, which are either the beard or the chest. In these cases, indeed, with great difficulty, we can take individual follicles from these areas, both from the beard and the chest, and transplant them to the scalp area. And if the surgeon's expertise is exceptionally high and refined, yes, he'll be able to ensure that these delicate hair follicles survive and thrive in very large numbers, almost similar to those originally on the head, and they'll also have a completely natural and seamless appearance, meaning they'll perfectly mimic the characteristics of the hair that was once on the head here. However, it is crucial for you to understand that transplanting hair from various body areas to the scalp is viewed as an absolute last resort. We only turn to this complex method when we are performing a difficult repair procedure and have completely exhausted every single viable follicle from the traditional donor area. I want to emphasize this point once again. In my own clinic, a situation like this never occurs when I have been responsible for managing a patient's treatment right from the very beginning. So far, in the many hundreds of different cases where I've been compelled by necessity to take follicles from the beard or chest or other areas, we won't mention names, it's only because previous clinics had severely compromised and damaged the donor area to such an extent that I could no longer offer a viable surgical solution for the patient with the follicles remaining here. Do you want to see new videos every week with before and after cases of hair transplant patients? Subscribe to my channel.